It's time for Half Hour to Health. Sit back, relax, and find out how you can live a better life. Here's your host for Half Hour to Health, Dr. Stephanie.
With me, Dr. Brooke from Crossroads Chiropractic at Bedford, and on the phone with us, Dr. Daulton. Dr. Ron Daulton's been a chiropractor for 25 years in Northwest Indiana, where his father was also a chiropractor for 43 years before his passing. He has published multiple books on natural healthcare, but is most well known for his book, Get Your Life Back, The Ultimate Guide to Healing a Herniated Disc, which first published back in 2007. His books, videos, and seminars have helped thousands of people all over the world, and we are here to talk with him today. Good morning.
Hey, good morning. I'm excited to be here.
Thank you so much for being on the show. Now,
Sure.
In full disclosure, I know you from a former life. We actually went to Palmer College of Chiropractic together.
We did, and we're celebrating our 25th year this year.
It's crazy. So 25 years ago, we graduated knowing so little, and
Right.
practice taught us so much. And you've written several books. What are all of your books?
So the very first book that I wrote is a book that teaches people how to heal a herniated disc naturally. And back at that time, there really weren't a lot of options. And in fact, when we were in school, they taught us that that was a condition that could not heal on its own, which is not true. And now we have plenty of research that supports the fact that there's so many ways to get that condition to heal without surgery at this point. And it was something that I was really interested in because one of the things that I've always looked at in my practice is anything that is regenerative by nature. And I love being able to take a condition that cannot heal or is supposed to not be able to heal and finding a way to make that happen naturally. So I got really involved with the disc issues, and I got very good at treating that. And we have so many different technologies in my practice that we use for that. And so I wrote the book about it, and it just became really big at that time. There was a period where my website where I was promoting that book was getting about 80,000 visitors a month. And so it sold tens of thousands of copies to people all over the world. I get emails all the time from people saying how much it's helped them. And for me, it's just been a way to expand my reach, to help people that I will never probably be able to meet in person. So that's where it started. And then I just continued writing books. I love the process. I enjoy helping people. So that's really what it comes down to.
That's amazing. So let's talk a little bit about your secrets for healing discs, because innate intelligence, that
Sure.
wisdom in your body, if it's flowing, your body has the potential to heal. And
Absolutely.
how do you tap into that?
So I really think that in order for anything to heal, really, but a spinal disc specifically, you have to give it the right condition. And so a lot of where that starts is nutrition is a huge part of it. You have to, I always encourage my patients who have these types of serious conditions to, number one, go on an anti-inflammatory diet. And by the way, that doesn't have to be complicated. To me, it's as simple as removing sugar from your diet as much as possible, eliminating white flour, anything processed. You want to try to eat a more natural diet. And the reason for that is because one of the biggest issues with a disc problem is that it can get inflamed really easily. And it's located right in front of the nerves. And actually what causes a lot of the pain with these conditions is that these discs will put pressure on the nerve. And so we want to remove the inflammation as quickly as we possibly can. So diet is a huge part of it. I also recommend a number of nutritional supplements for patients. So very easy things that you can find anywhere. Fish oil is really helpful for this condition. A joint support formula has glucosamine and chondroitin is really important for it. That will actually help the disc create new cartilage. Collagen is another thing that I recommend because that's also something that's useful for creating cartilage. And then also, one of the most important things that I feel as far as getting a disc to heal is, we call it imbibition, but essentially what we're doing is we want to create a situation where we can pump the damaged disc. And there's a really easy exercise you can do that will help with that, where you sit on one of those large therapy balls and you just want to gently bounce up and down for about 5 minutes a day. And what that does is it pumps the disc, and what that's doing is it's pumping out toxins from the damaged tissue, and it forces the disc to absorb fluid, oxygen, and nutrients so it can start to build new cartilage faster. So that's really the ultimate goal. Now, as far as treatments are concerned in my practice, we do a lot. Decompression is a treatment. It's a very controlled treatment where we are tractioning and then releasing the damaged disc. It's essentially pumping the disc just like what I was just talking about. And then recently I added a new treatment that really has made a huge, huge difference called shockwave therapy. And this is, you can find it under a number of different names. Some people call it soft wave therapy. They're essentially the same machine, but they may be slightly different, but it's the same technology. And what the shockwave does, and the reason I like it, is because it causes stem cells to multiply within the damaged tissues. And so we can take a condition that used to take months or even longer to heal, and we can decrease that time dramatically because as the stem cells reproduce, they create new healthy tissue more quickly. So those are a lot of the things I talk about in the book. But I would say those are probably the most important things as far as what people can do to help it heal more quickly.
Awesome. Now, where can people find your book?
Amazon. Amazon's probably the easiest place. You can also go to my website. My website is drdaulton.com, and let me spell it because my name is spelled differently. It's drdaulton.com. And that's actually my clinic website. You can find all my books there as well. But just do a search on Amazon for Dr. Ron Daulton Jr., and you'll find all of my books there.
Awesome. So some of the questions that I get asked frequently in practice, especially when dealing with people that are trying to help heal a disc, or maybe even don't even realize that they're trying to heal a disc. Ice or heat? What do you recommend?
Ice when it's inflamed. Yeah, you have to be very careful with that. If let's say that the disc is causing a lot of pain at this moment. What's happening is that there's a lot of swelling happening right there around that nerve. And so if you apply heat to that area, you're going to draw more blood to the area. So it's going to swell more and it will cause the nerve to get more irritated. So when it's actually inflamed, you want to start with ice. And it's really important that people don't overdo it. I have a lot of patients who want to sleep on the ice or heat, whatever they're doing. They just want to leave it on for forever. And you really should not do that. The rule is 15 minutes on, and then make sure you wait at least an hour before you treat again.
Okay. So you don't want to damage the skin with using the ice for too long.
Correct. You got to be very careful. You could cause frostbite, and we don't want to do that.
And do you recommend like the frozen bag of peas or the actual ice?
You want to use actual ice, and that's actually really important. The difference is that actual ice will maintain its temperature through the entire treatment, even if it melts. Whereas if you have a bag of frozen vegetables, it's going to be one temperature when you start, but as it warms up, it's going to lose its coldness. So you're not going to get the same benefit. So you definitely want to use real ice.
This is a Dr. Daulton hack right there.
That's good to know.
Yeah. Reading through the book, I'm like, oh yeah. I always use ice, like real ice, but I never realized why.
Yeah.
I love using real ice.
That's the reason. You want to make sure you maintain that temperature. And can I say one more thing about the ice too?
Yeah.
Because this is one thing that people don't understand. When you do the ice treatment, at first it's going to feel cold, which for a lot of people that feels good because the area is inflamed. But then what's going to happen is it's going to start to burn. And that's where people want to stop the treatment. And that is the worst thing you can do. If you stop at that point, you're not getting the full benefit of the ice treatment. So if you push past the burning sensation, then it's going to feel numb. As soon as it feels numb, now you've accomplished the purpose of the treatment. Because not only are we reducing the inflammation and the swelling in the area, but you're also numbing the nerve so that it reduces the pain faster for you as well. But you got to get past the painful part of the treatment before you get the full benefit.
This is a no pain, no gain situation with the ice.
Exactly. And honestly, a lot of the things that people have to do in order for this condition to heal are not always pleasant. Like I think about the decompression treatment. It's amazing what it does, but it is. I always tell my patients, this is not going to be the feel-good treatment. You're not going to like me when we do this, especially at the beginning, because at the beginning, there's so much toxicity built up within the disc because of the damage, and it's going to start to release that. And when you release that, it will irritate everything. It's going to be tender at first.
Mm-hmm.
So with a lot of the things, even that I talk about in my book, we don't expect it to feel good right away. Like, that's not really what we're going for. What we're going for is actually reversing this condition and getting it to heal.
Before we take a break, I want to ask you, it's the balance between getting through life and the things that you need to do and daily activities that totally impact our healing. How do you, explain to your practice members and people who are recovering how sitting for too long or standing for too long or lifting or bad lifting, ergonomics, so on and so forth, affect their healing?
So, I think I look at it maybe a little differently, because one of my goals with everyone that comes to see me is that I want to try to get their condition to heal in the environment that they want it to function in. So, for example, I have a lot of patients who say, should I take off work while we are working together? And my answer generally is no, because even if you're hurting when you're going to work, I want this condition to heal with your body being used to doing the work that you want to do. Because if you take too much time off, your body gets deconditioned, and then it's very hard to get that person back into their normal routine. They're actually more likely to re-injure themselves that way. So as long as the patient is still healing and responding, I try to keep them in their normal activity. Now, granted, if you have a job, let's say that you're sitting all day, that's where I think it's important that you actually have a proper consultation with the patient and know exactly what they're doing, because then I would say to the person, you really cannot be sitting all day with this. You've got to get up and move. So the rule is you can sit for about a half an hour, especially if you're healing. But at that point, you need to get up and just walk around for a minute or two. Same thing if they're doing a lot of heavy lifting. I may recommend that they put on a low back support just while they're lifting. But you got to be careful with those too, because if you wear that too often, the muscles will start to go weak, and it will create a whole other problem that you don't want to be dealing with. So I would say, any advice like that, I want to make sure it's specific to the patient. But in general, I try to keep them doing whatever activities they're used to doing as much as we possibly can, because they're going to be stronger at the end if we can get it to heal under those conditions.
That's great advice. So we're talking this morning with Dr. Daulton, Dr. Ron Daulton. He's a chiropractor in the northwest area of Indiana, but a graduate of Palmer College of Chiropractic in Iowa. We've got to take a break, but we'll be right back here on Half Hour to Health.